I'm Annette John-Hall, and I'm host of The Why. And we are a podcast broadcast that, hello, Keisha, hello, Tiana. We are a podcast broadcast that is only doing podcasts right now since we are working remotely, but I hope you get the opportunity to download us to your podcast library and listen to us when we come back on the radio at a time to be determined. But thank you so much for logging in with us today. We have a lot of interesting things to talk about. If you want to know how the journalistic sausage gets made remotely during this pandemic, we are here to answer those questions for you. But first, just a few logistical things. You guys seem to know already how to ask us a question or send us a message in the chat window, but we want you to ask questions. We would like for you to just hold on though, for the most part, because we are going to have like a 35-minute discussion, and then we're going to have the 15-minute Q&A. And, basically what I'm going to do to kick this off, we have three of our unsurpassed reporters. I'm telling you guys, if you only knew, but we're going to get into it a little bit. Our reporters have been going, we are essential, first of all. We are essential, and it's very imperative that we get you the news during this time. But our reporters have been going above and beyond, and oftentimes putting their own health in peril to get you the news that you deserve. So I'm just going to go around the horn and ask everybody to introduce themselves and share a little bit about what they do, starting with our fantastic health reporter, Nina Feldman.
Hi, everybody. My name is Nina Feldman. I report on health for WHYY on the radio and online. Before the pandemic, a lot of what I wrote about and reported on had to do with a different type of epidemic. I reported a lot on substance use disorder and the opioid epidemic here in Philadelphia and New Jersey and across the region. So I had a little bit of familiarity with sort of people who are thinking about epidemiology and infectious disease and how it spreads, but in a very specific context. So, reporting on the COVID-19 pandemic, I think for everybody has been brand new, and certainly has expanded the scope exponentially of everything that I've been looking at. So that's sort of just a bit of where I've been and where I am now, and I'm sure we'll come back to more.
Mark?
Sorry, let me unmute myself. Sorry about that. That's what everybody's saying these days now on Zoom calls, right? So I'm Mark Eichmann, and I am the deputy managing editor for WHYY's Delaware desk. And so my beat is Delaware, just kind of everything and anything that encompasses the state of Delaware. And for the past month and a half, that's been, like Nina said, health. We've all become kind of health reporters in a way. So that's what we're covering, and just trying to track where Delaware is at in all of this, and it's its standing in fighting this versus its neighboring states, and trying to coordinate actions in Delaware with Delaware's neighbors in Pennsylvania, New Jersey, and also in Maryland, and kind of the friction that can cause at some times too. So that's me.
Joe.
Hey everybody, my name is Joe Hernandez. I am the New Jersey State House reporter for WHYY, although I haven't been to the State House in weeks because it's closed and nobody's inside, so now I'm just the New Jersey reporter, I guess. But we've been, New Jersey's the second hardest hit state in the U.S. by been a lot going on, a lot of sad stories and a lot of uplifting stories. But like Mark said, we've all kind of had to become health reporters and track how the states are doing this differently. Where are the gaps? But also just, getting out information to people, kind of like when there's some kind of natural disaster and we become more like conduits of information to people. It's felt like that, but over a prolonged period of time. So there's both going on, and I'm sure we'll talk about that.
Yeah. I'd just like to kick it off with basically when the stay-at-home order came down, and I will reiterate that we are essential. So we were required to work, but our managers allowed us to work at home. So that really meant some adapting. We were scrambling to try to create a studio kind of environment for guests. I'm just speaking for myself at the Y. I tried to figure out, how am I going to host guests when I don't even see them? And, and how am I going to sound good? So I wound up putting a blanket over my head, trying to record with my gear and having guests send voice memos on their iPhones. Oh, let me tell you, it's like a real process to just try to get the show made. But let me go around again, starting with Joe, and ask him, how do you cover your beat? How do you cover your beat with the order that's in place?
So in normal time, let's say you'd have a press conference. The governor would come out with health officials in a room at some location, and usually the state house or his office. All of the reporters would pile in. The cameras would be there. Everyone would be in. It's hard for that to happen now. So the governor is still holding press conferences, but people are social distancing. They're also streaming them, which makes it easy for us and for other outlets to get the information over the internet. And that's one way things are different, that a lot is happening remotely now as opposed to in person, like you said. Although Nina could talk about it, I'm sure there are still in-person interviews happening. But because we're radio reporters, we can't just necessarily call somebody up on the phone and get their comment and hang up the phone. We need to think about audio quality too. So that's changed things as well. Like you said, Annette, the iPhone microphone is actually pretty good. It's a wonderful thing. And so if you can get someone to call you up on a landline and record themselves on their iPhone and then send that to you, it brings the audio quality up a notch higher. But as you also said, these are extra hoops that we have to jump through. Everybody is adapting to this new way of living, but that's one of the small ways I think we're doing it, to be able to do our jobs and bring people good quality audio over the air at this time.
I wanna go to Nina, because Nina, I am constantly astounded by not only the number of stories and really poignant stories that you've done recently. I'm thinking about the nursing home one that you did with Alan, but the quality of sound that comes with the stories that you've been able to produce, the multiple stories that you've been able to produce on your beat in this last month. Why don't you talk a little bit about how you've been able to do that?
Sure. So, I think everyone is trying to keep safe social distancing practices when possible. And if I can get somebody to talk to me, like Joe mentioned, using an iPhone and recording themselves, or I've actually found that recording through Zoom is not that bad. And that way you get a sense of actually seeing somebody. The quality is certainly not good as if you recorded in person, but it's better than just talking to them over the phone. And then you can see them and maybe ask them to show you around where they are. And it's a little bit like you went to their house for an interview, because you're there and you can kind of get a sense of what's going on where they are. So that's one little strategy. But then there are some things where, being as safe as possible, going in the field, like olden times, really does make a difference. So one example that comes to mind is I had been in touch with a couple of a pair of sisters who are both nurses that work at Einstein Medical Center in Montgomery County. And their dad had just passed away from COVID-19. And they were that we were talking on the phone and hearing about the whole process and how hard it had been. And they hadn't actually been allowed to see him in the hospital because of a really strict no visitors policy, even though they worked in the hospital. So they were really frustrated about that, also grieving. And then all at the same time, the next day, they were planning a funeral procession with a line of cars for him, because nobody's allowed to gather and have an actual memorial or funeral. So I said, that seems like a good opportunity, a good safe opportunity to be able to at least wave from a car window and meet these folks who I've been sharing these really intimate moments with over the phone. And so I got in my car and I drove to Einstein, where the procession started. And then the plan was to drive to the funeral parlor, which we did. And we got there, and there wasn't really anything to do once we got there. There was no ceremony. People weren't really congregating. That was the whole point of having the car procession. And so when I got there, we've been given these long boom mics that can sort of extend your arm by almost 6 feet. If you stick your arm out with this thing and attach a microphone to the end of it, you've got the 6 feet of social distance. So I got out of my car and I introduced myself to the sisters who we'd been speaking with. And we just had this conversation in the parking lot in person. And I honestly didn't know if something like that was going to happen when I went out, because there's just everything. It's like learning how to do your job all over again. Everything is so new. The expectations are everything is off the table. Everything is on the table in a certain way, actually. It's sort of like, you don't know what's going to happen when you go out in the field. So I think as long as I kind of keep safety first, you can kind of open yourself up to all these possibilities. And these sisters were up for talking, and we all had masks on, and I kept the boom mic 6 feet apart. And we had this conversation that allowed for, I think, the sound quality that you probably heard in that story. So I think my key there is just kind of being open to the possibilities and the direction that the story can take you, without really having a preconceived notion of how it's going to go, because all of this is so, as everyone has been saying, unprecedented. So, yeah.
So, and I saw Nancy's comment. I thought this was going to be a coronavirus discussion. Nancy, it is. We are going to get to some specific coronavirus questions in a moment, but I want to encourage everybody to start writing their questions so we can get to them during the question and answer period. Mark, have you had any occasion to cover stories where you've had to go out in person?
Sorry, again. Yeah, infrequently. So, it's part of what protecting ourselves has become is finding what stories do you absolutely need to be there for, like obviously Nina's story for sure, and then like Joe said, what story can you get virtually, and so that's sort of a whole new kind of decision-making process when it comes to evaluating stories. What story is worth being on the ground for? What story can you figure out a new, and like Nina said, unprecedented way to get details and to get audio and to find things that we haven't done before. So yeah, I've been out for a couple of different events that have happened. The Newcastle County added some Wi-Fi hotspots to libraries and service centers the county has for kids who don't have access at home, so they can come out and be in the parking lot and connect to their schooling and try to just catch up on what assignments are or whatever. So the one thing I have to my advantage is my arms are really pretty long, if you can see. But so working that with long microphone, you can, and just have the person shout a little bit louder than they normally would, maybe. Yeah, so it's just kind of a new wrinkle in the decision-making process of how do you cover a story, and is it worth being on the ground for?
Sure. You know, I think that everybody is wondering when these stay in place orders are going to be lifted, and they're being relaxed a little bit. But it seems to me that there's a disconnect with, relaxing the orders and people still getting sick. I don't really. The last graph I looked at with Pennsylvania and New Jersey showed a little bit of flattening, but just a teensy weensy bit. So have you guys been able to ask any elected officials about that disconnect, about that, how they are? I think that Pennsylvania's starting to relax some of their restrictions tomorrow. So have you guys been able to talk to officials about how does that jibe with no movement in terms of cases, no discernible movement with cases going down and less people getting sick?
Can you hear me?
I can.
I think, most of my focus has been on Philadelphia, where I think we can safely say that there has been some.
Nina, it sounds like you're frozen a little bit. I do know that Philadelphia is one of the hardest hit cities in Pennsylvania. So we're really curious to hear about Nina's response when she gets unfrozen. But Joe, can you tell us a little bit about what's happening in New Jersey? And
Sure.
Because I know New Jersey is the third highest state of cases in the country.
It's the second highest, actually, behind New York. Yeah. So the way it happened in New Jersey, the cases exploded and the number skyrocketed all of a sudden. So over a couple weeks and after these social distancing measures, that number started to flatten out. The curve started to flatten of new cases. The start, that's where you begin kind of getting a handle on all of this, because as you rightly say, there are still thousands of new cases every day. There are hundreds of new hospitalizations every day, including today, and there are hundreds of new deaths every day. So flattening the curve is important to lower the burden on the healthcare system, but flattening the curve does not mean that the virus is suddenly defeated or that any of these measures become moot, because the virus is still present, and all it really means is that you're avoiding the worst case scenario right now. And so in New Jersey, I can't speak for Philly or Pennsylvania or Delaware, but in New Jersey, the governor there says basically he's been pretty cautious about this, honestly, and he's gotten some flack for the severity of the restrictions. But he says, until we see a meaningful decline in those new cases, which they haven't really seen yet, there's kind of no reason to lift these social distancing measures and the stay-at-home order because it may not be intuitive, but those restrictions are the cause of the flattening of the curve. So just because you flatten the curve, sorry, my dog has a comment to make as well. Just because
when we're at home, I have one too, and I'm telling you, we're recording with guests, and she just blows it all.
You're at their behest, yeah, basically. Anyway, I'll just wrap it up there. That just because you're flattening the curve, that's thanks to those measures. So the governor of New Jersey at least says until we see the curve start to decline, we can't really talk about lifting them.
And what about the beach towns, Mark? I have a very selfish reason for asking this question, because I go to Rehoboth every year. And we have something booked for 4th of July weekend, and I'm not sure what's going on. So I know that the governor had put restrictions on the beach towns there. So what's happening now?
Yeah, and those are still in place. And I know, unfortunately, for your 4th of July plans, at least the fireworks and all those kind of celebrations have already been canceled. in Rehoboth. And an interesting thing that happened this week at the beaches, Ocean City, Maryland is opening either tomorrow or Saturday. So, and that's just across the state line from the Delaware beaches, from Fenwick. And so there's maybe some spillover this weekend into the Delaware beaches of folks going to Ocean City, Maryland, which will be open, and the Delaware beaches, which are still not open for any kind of real activity beyond just walking by. So there's been no action, and Governor Carney this week said he was kind of disappointed in the decision to open Ocean City, Maryland, because he had been trying to work with Governor Hogan in Maryland to coordinate those things, that they would be done at a similar time, and that hasn't happened. So the beaches are still a question mark. So see about your trip.
Well, we'll see. I mean, it doesn't. They're canceling the fireworks. That doesn't bode well, right?
Yeah.
Nina, can we hear you, Nina?
I'm back. Sorry about that.
Nina's back. So, Nina, you were going to talk about Philadelphia and the number of cases there, I believe.
Yeah, so the mayor here the governor set, and sorry if I missed this when I dropped out for a second, but the governor has set the threshold for reopening businesses to be about 50 cases on average, 50 new cases on average for a period of 2 weeks per 100,000 people. So that's not necessarily a number that makes sense to a lot of people, but there have been some graphs to sort of visually represent it that I think are really helpful. And where we are right now is maybe, at least in Philadelphia, like 7 times that number of 50 new cases per day per 100,000 people. So we got a long way to go. But it is the numbers are going down per day, but we're just not there yet. It's just kind of that simple.
Everybody has seen the protests that have been going on with people wanting their towns to be back open because they've lost their jobs. They have no source of income. And I'm wondering, how do you reconcile? I mean, just based on your reporting, and forgive me, guys, if I'm just going from one topic to another, but I'm asking these experts questions that I have questions about. And, on the one hand, we have lots of cases, and I'm using Pennsylvania as an example. We have lots of cases in Eastern Pennsylvania, like in Philadelphia, but we don't have, and maybe Pittsburgh, but we don't have that many in the middle of the state. And so justifiably so, people are complaining that they need to get back to work. But how are officials trying to reconcile that based on your reporting? Can we start with you, Nina? Have you talked to anybody about that? The unemployment issue?
Sorry, I was muted. I think that's why there has been this effort to have a sort of piecemeal reopening approach. It's because there is this enormous balance that all elected officials are trying to strike between, completely grinding the economy to a halt and maintaining public health. And I think everybody recognizes that if we get things started too quickly and too fast, then the risk we run is having another outbreak and more people getting sick. So I think that's part of why there has been this effort to do reopening in places where there aren't a lot of cases, and hold off in places where there are, and the risk is more real, that if everybody kind of went out and went to restaurants and bars as the weather gets nice and kids were all running around together who, might be exposing their parents, or people started visiting their elderly relatives again who are super vulnerable. Well, then, if people are doing that and the case counts are still up, then I think it runs the risk of having to shut everything back down again in places where there are those case numbers. So And, there have been reports now.
I'm wondering, how do you react as one state,
Yeah, and maybe Joe can talk about this, because I know that Governor Murphy was a little bit more inclined to have a sort of like unified state strategy, whereas Pennsylvania, in part, I think just because it's a bigger state, and there are more, larger swaths of rural areas, is doing a little bit more of a piecemeal approach. But I think one thing to note too that's interesting is this: yes, there are these protests that we see, at state capitals trying to get things to reopen. But at the same time, you look at places like Georgia, where things have reopened to a certain extent, to a small degree, and then internationally even, and people aren't just like rushing out their doors and going to the shopping mall. People are still really scared and really freaked out. And I think this has done something to our consciousness and our awareness of what it means to be in a crowded place, that makes those places seem, for a lot of people, really risky, even if those regulations are loosened and the restrictions are lifted. So I think that's just something to keep in mind, that there is this idea that we want this to go away, and we want things to go back to normal. And I think it's really hard to recognize that there isn't, if there's ever going to be a normal, it's not going to be for a really long time, even if these restrictions are lifted little by little by little, place by place by place. So I think that's hard to wrap your head around, but we've seen it in the places where those regulations have started to lift.
Does anybody want to add to that?
Yeah, I think. Go ahead, Joe.
Go ahead, Mark.
Well, it's thank you.
Why don't you go ahead, Mark?
It's interesting in Delaware, especially looking at how bad things are in New Jersey, where Joe is, and even in Philly, because our case numbers are so much lower. Part of that is a function of the population just being so much lower, but we only have less. It's less. The state reported today, I think, less than 6,000 cases in Delaware, which is, tiny. If you look at the graphs of the three states, Delaware is nowhere even near off the bottom line almost in comparison to where New Jersey is. So there was protests, I guess last Friday, in both Wilmington and Dover, and those folks kind of point to, look at how much better we are than say New Jersey, and it's time to open up Delaware economy. The problem in Delaware is the situation is so much worse in Sussex County. In Georgetown, I think, has like 450 cases per 10,000 people, which is way higher than up here in the north. So people want to open the beaches, but that's where it's so much worse. So there is kind of this disconnect of comparing the states to each other and also trying to get areas of the state open up at different times is I think really difficult.
Yeah. Your turn, Joe.
Yeah. A word on the protests. I mean, we've had those protests in New Jersey, and I've even written about them. But there have also been polls conducted about the support for these social distancing measures, and they are far, far more popular than any of these protests would suggest. Like 80-90% of residents support different social distancing measures and 6-foot distance requirements. So seeing footage of a protest might give you a kind of not quite the right view of where the entire state stands as a population. That said, there have been more than 1 million unemployment claims in New Jersey. So the economic pain is absolutely real, and people do want to get back to work. So I think that's totally valid. But as Nina mentioned, just real quick, I mean, the governor of New Jersey has been trying to do the recovery regionally. So he's working with Pennsylvania and New York and Connecticut to kind of do this opening all together, so one state doesn't move much faster than another state. And he's also thinking about that within state. He doesn't want to say the northern region, which is seeing its cases decline, to open up quicker than the southern region, which is still seeing them increase. Because people might drive across state to go to a bar or restaurant or a store or whatever. There are really no barriers there. It's just county lines, which are invisible. Yeah. So the state is probably going to act as one state as far as the recovery goes.
And one more thing, if I could, about the protests. It's the one place where, and Chris Barish, who works with me out of the Delaware office, has covered a couple of the protests. And it's kind of the one place where folks will talk to you and be up close to you without wearing a mask and without being concerned about that. And it sort of adds another level of difficulty to the decision of, do you send a reporter to cover a protest where there's people not going to be following guidelines that are set in place to keep everybody safe. And it's something the governor had a press conference the same day as there was a protest outside of his office in Wilmington, and said that these people have the right to do it, but they don't have a right to do it and break the law to do it. So it's just another interesting wrinkle in trying to coordinate coverage and plan for this and protect ourselves while covering an important aspect of the story too.
Absolutely. Let me reintroduce you guys, because some people have come in late and they don't know who you are. So I have absolutely no idea if they're seeing you, if our audience members are seeing you like I'm seeing you. So I will just start with the lovely woman on our panel, who is Nina Feldman. She's our health and science reporter, who has been covering this pandemic day and night. And we are so grateful for her stellar reporting on this. Oh my goodness, I have to plug in my battery on my computer. Joe Hernandez covers New Jersey for us. And that's Joe waving. And Mark Eichmann covers Delaware for us. And so I'm going to toss this question out there, and then I'm going to go get my plug for my computer. And that question is, I want to talk about elections, Joe. We've pushed the primaries back in Pennsylvania and New Jersey and Delaware, Mark, to June 2nd, 3rd.
Delaware just got pushed back today till July.
Oh my goodness. Okay, so news on the Delaware front. And this has really kind of turned into a partisan battle, because while the Democrats have really pushed for online voting because of the safety element, and as we know, a lot of the poll workers at all polls are seniors and very much susceptible to infection. But it seems like the Republicans are pushing back a little, saying that, voting online benefits Democrats because they're more Democratic voters overall, and they're concerned also about voter fraud. So what do you guys make of that? Joe, I'm going to start with you, since you cover politics in New Jersey. And where is that battle heading?
It will be interesting to see. I mean, elections and politics is one of those things that has had to change a lot since the coronavirus took hold. I mean, previously in New Jersey, if you wanted to get on the ballot, you would have to file a petition and go around and get signatures. And that means walking, through neighborhoods, knocking on people's doors, sharing a pen, basically, to get them to sign your petition. And so the state had to change the rules around petitions to allow people to offer them and sign them remotely. And then the question becomes, what happens on election day? And we saw in Wisconsin some of the dangers of what could, occur. There goes Nina. dangers of what could occur with in-person voting. And in New Jersey has had mail-in voting for a long time, but it's recently been expanding it. And even in non-coronavirus times, expanding it has been difficult. And so what will remain seen, I think, is what's required to do mail-in voting, like a massive mail-in vote for a primary election or even a general election in the fall is going to be a massive effort that the state, election apparatus may not be prepared for. And so that's one of the things that in the coming months, I think the state is probably ramping up to. But they have switched some elections to mail-in ballots only, but those were local elections. We haven't done a mail-in ballot only statewide election, and with 9 million residents, that will be a tough thing to do.
Mark, what did we hear in Delaware?
Well, part of and they just changed this along with the announcement today about suspending or postponing the presidential primary till July 7th, that they're now everybody's going to get an absentee ballot application and be able to vote absentee, kind of no fault absentee for any reason that you put in for your application. But they're still going to hold open 7 polling places, I think, in each county to have people come in and vote. But haven't heard much of pushback against the mail-in voting here.
Great. Well, that's a good thing then, because everybody wants to stay safe.
Right.
I'm wondering, as we look toward the summer, and I saw Rosa's question about I would like us to end with something in your reporting that gives us all hope. So I want you guys to be thinking about that as well, because I think that's a great question. But I'm wondering, looking forward to this summer, I don't know if you've been able to, based on your reporting, find out a little bit more about looking into that looking glass and kind of predicting what we're going to see this summer in terms of whether hotels will be open or whether gyms will be open, or what can we count on being relaxed. I mean, have you talked to anybody who talks about what's going to happen with schools, for instance? Can you just give us like a little peek into the future based on, the officials and people you've talked to? Nina?
I'm Nina, not Mark, even though it says Mark.
Nina.
I don't know how that happened.
Identity fraud is real. Okay?
Yeah.
Identity fraud.
Oh, you can look up like the Brady Bunch. I love that. You can
peek into the future. I mean, I guess I have to say that my reporting has been a little bit more focused on people who are treating the virus and in various settings. So whether that's somebody who works in a hospital setting or works in, a congregate care setting, so a nursing home, facilities like that. And I think that the perspective for those folks is really different than for a lot of other people who might be sitting at home anxious to be able to make a decision about whether it's time to, whether, some of us, like you mentioned earlier, Annette, we're worried about like whether our vacation for the summer is going to be on or off again, or when we're going to be able to go on an airplane, or when we're going to be able to send a kid to camp or not, which are all completely valid and real concerns for how we're going to move forward with our lives on an everyday basis. But I think most of the sources who I talk to are so deep in the woods with this thing that it's just like a different, it's a different context. So they're not necessarily thinking as much about how, the everyday aspects of life are going to turn out. It's like, when is the hospital going to be able to start doing any procedure other than dealing with COVID, because they all cleared out to make room for that? You know what I mean? So I think, it's when am I going to be able to go to work not wearing a mask every single day? Or when am I going to be able to go to work and not wear the same mask all day, every day, and be able to change it in between patients that I see? So I just think like the calculus for what the future looks like for a lot of the healthcare workers that I'm talking to is more sort of, when are we going to get this virus into a manageable stage where we can contain it and track it, versus just mitigate it and respond to it. And I think that's kind of it's in some ways it's a much it's a much less distant future. Like, the scope of the future is a lot closer in that sense. It's sort of like a day by day type of evaluation and analysis, rather than when are things going to be back to normal?
What have you heard about? Have you heard anything about vaccines? A vaccine?
Well, I mean, the optimistic time frame that Dr. Anthony Fauci put out was, 12 to 18 months. And, from everything I've heard, that would be, I think the federal government is using the phrase Operation Warp Speed for this endeavor. And I think that that's pretty accurate. There's the record for developing a vaccine. The record speed for developing a vaccine ever has been 4 years for the mump vaccine. So doing it in 18 months would be, again, unprecedented. But also science has evolved a lot. And if you got an all hands on deck situation, and obviously this is a crisis, I don't think it's impossible. But again, with every sort of fast-paced scientific endeavor, you run the risk of missing things, and you run the risk of creating an even bigger problem. So the last thing you would want is to rush something not tested appropriately in the labs or on, before actually administering it to humans, and then find out that in the long term, it has some sort of terrible adverse reaction that causes complications down the line. So I think, as much as that feels like the panacea cure-all for all of this, and then we could snap our fingers and have things go back to normal, I do think even with that, knowing that we have to take our time to get it right, it's an exercise in patience for all of us.
Sure. Joe, a look into the future for Jersey?
Contact tracing, I think, is going to be big. The governor keeps talking about.
And for those of us who don't know what contact tracing is, can you explain?
Yeah, sure. And Nina will correct me if I screw this up. But contact tracing is when someone gets a confirmed case of coronavirus, a contact tracer reaches out to them and says, okay, what have you done, where have you been, and who have you been in contact with in the past X amount of days? And then the person gives them a list of all those people, and that is a list of people who potentially got coronavirus from this person. And then the contact tracer will call those people and say, you may have been in contact with someone who has coronavirus, self-quarantine for 2 weeks. And officials think that this is one way to kind of keep a handle on the virus going forward, because if you can kind of target, if you have fewer infections, I mean, right now, New Jersey has thousands of new infections per day. So doing a contact tracing operation for that high number is kind of impossible. But if the number legion of contact tracers who can track where the virus is going and where it's been, that might be one way to keep infections down. 6 fines on the beach.
Thanks, Joe. Mark, a look into the future for Delaware. Have you heard what Delaware may look like this summer, or what we can celebrate over or be distressed over?
Yeah, well, we were kind of surprised earlier this week when I guess it was Monday or Tuesday this week when the governor announced that there's going to be the first baby steps to the first phase of reopening for Delaware. So starting tomorrow morning, I think at 8 a.m., stores, clothing stores, shoe stores, sporting goods stores, tobacco stores, all kinds of different businesses are going to be able to open and provide curbside pickup. So people won't be able to go into a store, but you'll be able to call a store and say, I want to buy, this Nike t-shirt, and they'll bring it out to you and give it to you on the curb, which is a tiny little thing, right? That's almost nothing, but it just felt like, wow, this is like, it's starting. The first step out the door, literally, is happening. And the governor said that things are improving case-wise here, that he expects to start the full first phase of reopening by the end of the month. So kind of some optimism here in Delaware that later in the summer we'll be into maybe the next phase. And a note on the contact tracing, that's also a part of Delaware's plan for phase one to have to open. For us to get into phase one, there has to be more testing, and there has to be the ability of the state to do contact tracing. And this week, U.S. Senator from Delaware, Chris Coons, joined a bunch of other Republicans and Democrats in Congress, introducing a bill that would add like 750,000 volunteers to the AmeriCorps program and provide funding for them to get a stipend to do public service, to do a lot of the contact tracing, because it's just going to be such a labor intensive, and those workers just don't exist at this point. And so if that gets passed, Senator Coons was saying earlier this week that it could be, those volunteers could be in place by a couple of weeks, not a couple of months. So I think that's, if that ends up happening, that will be a big step towards that contact tracing, which everybody says is going to be a big part of getting things back open again.
Yeah, absolutely. We just did an episode of the WHYY on the public health nurses that are the main contact tracers in Pennsylvania, and how their budget has been slashed and burned over the past 20 years to the point where there's just so few of them to do this work. And the problem is that if they're doing their work correctly, you don't hear about them, and they have been doing their work really well, but they've just been totally overwhelmed with this pandemic. So if there's any, blessing that comes out of this, is that they will get their budgets reinstated to do this kind of work. And yeah, AmeriCorps is going to be involved. Governor Wolf is going to lean on the public and nonprofit organizations to enlist people and train them to do some contact tracing. But let's talk about hope. Have you guys in the course of reporting have done any feel-good stories? Have you been able to, just get out of the doom and gloom for a minute, and can you share with us maybe something that can give us all a piece of hope going forward? Nina? Uh-oh.
I can speak to that at the very beginning. Frozen?
No, go ahead, Nina. You're okay. Oh, wait, she's frozen again.
Okay. See. The beginning, just to keep on. Right at the beginning of this, can you hear me?
You're kind of going in and out.
No. Seems like that's a no.
Yeah, you're kind of going in.
Okay, here I'm going to try.
Okay, we lost.
Turning my video. Yeah, I took my video off, but can you hear me?
Yes, we can hear you.
I'm just going to talk about the video. I think it's a slow internet connection. So right after the shutdown order went into effect, I saw that there were because so many of the restaurants, that was like the first thing to go before, so many layoffs swept the city and the state and the nation. The restaurant industry was kind of the first thing where everything just shut down. And so one thing that I saw online was a small restaurant owner who basically shut down for everything except for pickup and delivery, just started doing family meal outside of their restaurant door. And the idea was also that for other restaurants that had shut down with very little notice, they collected the leftover food that those restaurants were otherwise just going to throw away because they had to shut down with so little notice, and then made meals out of that, whatever they had, and kind of distributed it to service industry workers in what they call this family meal, which is, if anyone's ever worked in a restaurant, the meal that you eat with your coworkers before or after a shift. And I just thought that it was just they sprung into action. Like they didn't miss a beat. It was like restaurants closed and the next day there was food for people to eat if they needed it. And that just seemed like it boded well to me to a certain degree, where it acted as a sign, an indication to me that, yes, things were about to get really hard and things were going to get worse before they were going to get better. But at the same time, like this instant reaction showed to me that people's first instinct is to take care of each other. And I found that to be really hopeful.
Yeah. That I see signs of that everywhere. Guys, I want to get to some of your questions because we only have, checking time, 8 minutes. And so I am going to scroll through the menu here and, Rosa's comment question about contact tracing being very difficult among the homeless population. And what about the folks who don't speak English? Are there translators to reach them? I'm sure that all kinds of people who speak languages will be trained to do this kind of work. But Nina, if you could weigh in on a little bit of the homeless population and how they can be found, do you know anything about that?
Oh. Yeah, and tell me if I start cutting out again, because then I'll just go off. Am I frozen, or can you hear me? Frozen.
Yeah, I think you should cut out for your camera like you did last time.
If figuring out how to respond to this pandemic among a population of people who are experiencing homelessness has been an enormous challenge for city governments everywhere. And, not just in terms of contact tracing, but in terms of testing and conveying messaging about social distancing. I was talking the other day to someone who works closely with the homeless population in Kensington, and she was saying, it took there was this lag time for people to understand the value of social distancing because a lot of folks don't have phones or social media. They're not watching the news. They're not getting the message. And so once that message was then transferred to them, of course, people understood and they did their best that they could. Of course, not being able to shelter in place in many cases because folks are unhoused. But I think there was just a lag time in understanding the importance of those practices. And then there was also a lag time in testing measures getting to those communities. And now, it's a little bit more accessible to get a test if you're experiencing homelessness or if you don't even have a prescription, have a medical practitioner, a family practitioner to get a prescription to go get a test from. But even if you get tested, it's sort of like, well, then what? If you find out you have it, then, for some folks, quarantining or isolating in place are just not options for a variety of reasons. They have work that they have to do, or they have substance use disorders that make it really hard for them to stay in a quarantine hotel, even if the city provides that. So there's just a variety of factors that I think makes this really, really hard for that population. And I think Rose's point about contact tracing just kind of falls into that larger bucket of I think a city official would tell you they still haven't, like they would tell you openly, they still haven't figured that out yet. This is just something that people are still working on.
Thank you, Nina, for that. I'm going to throw this to you, Mark, because you have kids. So I'm wondering, Tiana asks, what advice do you have for kids on handling the coronavirus and staying calm? What have you? I mean, you guys have had a captive audience with your kids, teaching them all kinds of lessons there. Yeah. What do you tell them about what's happening and keep them, calm and feeling safe?
Well, my sons are 15 and my youngest will be 12 in a couple of days here. And they're really pretty resilient. Honestly, they've adapted to doing like online school way better than I expected. And I think they've kind of appreciated a little bit more of family, of together time, because we're always everybody's just so busy and running, that we've really tried to double down on taking the time to be together and appreciate being together. We've started going on walks every night. We've started having everybody pick a game every night to make it, as much as it sucks, to find a new way to be together, and find the positive in it, and find the kind of find the meaning in maybe what we had forgotten about being together, and how we're able to share experience. My son's a freshman in high school this year, and the clock feels like it's ticking, right? But this has been a chance to slow that clock down a little bit.
Down a little bit, yeah.
And so that's kind of what we've tried to lean into.
Yeah. I want to ask Joe. I find this a very interesting question by Jim Ryland. I hope I'm getting your name right, Jim. Who are people looking at for clear leadership during this crisis? Now we see, for instance, we see Andrew Cuomo on TV every day, on the nightly news, and now everybody's saying he should run for national office. But really, on a local level, who do you think people are looking to for leadership, whether it be their elected officials or their religious leaders or their mom and dad? Who do you think?
Yeah, I don't know. I mean, in New Jersey, at least, the governor has been holding these daily briefings on video that are streamed, and I've covered him for a couple of years now, and he used to stream all of his press conferences, and he would get maybe like 50 people watching it on YouTube, and now it's like 5,000 or 3,000 or something each time. His approval ratings have gone way up. I think people appreciate what he's doing. So in that sense, maybe people are looking to him for leadership, but you asked the question earlier about hope, and one of the things that he's been doing is in these daily press conferences, sharing inspiring stories every day. He created this hashtag, and people have been sharing stories that inspire them in New Jersey every day. And he's been sharing 3 or so of those every day, anywhere from kids like Mark's who are stuck home and doing something for the recovery effort, to people who've had to, close their restaurants, or they're donating food. it seems to me, anecdotally speaking, like people are looking not just to their elected officials, but to just their community members and their neighbors, who, as Nina said, have stepped up in ways that during normal times we might not have needed them to step up. But now that they're needed, people who are able to are answering the call to help each other.
Yeah. Well, you guys, I am the timekeeper, and I was told not to go over 5 o'clock. It's 5 o'clock. And there are those of us who still have work to do, unfortunately. I have to put a show to bed. And so I just really want to, and I'm so grateful that you guys think that we're doing a good job. I've been scrolling through the comments, and I see lots of thank you to us for our reporting. We thank you. We thank you for thinking that we are essential. We are trying to provide you the best reporting that we possibly can, because it is important to do that. It is important that you are informed, and we're trying to do that in the midst of this really unprecedented time. Thank you for acknowledging that. I want to thank our reporters for taking time out of their busy days to be with us. Nina Feldman, Mark Eichmann, Joe Hernandez, thank you. And we will be also looking at your feedback in the comments. And if you have any story suggestions, please do put them in the comments, and we will, we're always looking for good story ideas. So thank you, and enjoy the rest of your week. Please be safe. Thanks so much.